So how are you doing?
I'm all right. I think I'm all right. No more than all right, but all right. What about you?
A bit better now. I'm starting to come back into the office. I found it, the longer lockdown went on, the more difficult I have found it. I felt like I'd lost connection. You know, you and me are quite similar, aren't in that we're huggers. We like people. We like being around people. We bounce off people. It's where I get my energy. And I don't get a right lot of that sitting in my study, or if I want a change of scene, I can go and sit in the kitchen. Or occasionally, if I'm feeling risky, go and sit in the garden. So it's nice to be back. What about you? Have you been out much?
Well, we're double jabbed, if that's a thing. So,
Two jabs in me.
Yeah. So we were joking about being invulnerable. I think that's the word, is it? But sort of partly, I just feel like I've forgotten how to be me. And have this underlining fear that I'll not, what, you and I, Aileen, we're of a certain age, aren't we? We're, and it's a glorious age and I'm grateful to be here. Yeah. But, for women in their 50s and 60s, you're a bit invisible and the world can't quite work you out.
Yeah.
And to some extent, you have to make sure people know you're there sometimes, otherwise. And I suppose a bit of my fear is that I will have disappeared by the time this is all over, which is, makes no sense. But we used to joke in the first lockdown or lockdown 1.0 that we'd go out for, when we had our 1 hour state sanctioned exercise, and we'd go out for our walk, and Nigel, as you know, my husband, much more of an introvert than me. When we walk down the street, and he'd just be walking down the street, and I would, try to make eye contact with random strangers, just to go, "Hi, how are you?"
You could say hello.
I've never spoken to that person before. We've lived in this street 30 years.
I did exactly the same. I dragged my children. I'm an older mum. And so my twins are 13, and every day during first lockdown, I took them out, whether they wanted to or not, come rain or shine. You can imagine I was quite popular. Do you know that person, Mum? No. Well, why are you talking to them then? Well, because it's polite to say hello and smile. But why do you talk to them if you don't know them? Well, I talk to lots of people I don't know, and actually, so for me, it's about the one of the impacts on my mental health has actually been around missing that connection and feeling. Yeah. So as somebody who is honoured and humbled and proud to be chief executive of a brilliant organisation like Grand Union, feeling that I'm kind of losing touch with bits of the organisation, and that's been a real challenge for me, because that I'm a wanderer arounder and have a chat with people and a park my bum on people's desks sort of person. And you can't really do that on Teams without making
and I think we're probably similar in this respect, though. I have to, and it took me a long time to work this out, I have to find some tiny weeny point of human connection before I can have a grown-up conversation with, so I'm always saying, "Oh, and how are your kids? Oh, you were making jam last time we spoke. Was it nice?" And that, but it's sort of, once you've done that bit, and you can go, "Okay, now we can move."
On. And yeah, go on.
And I miss, I really, really miss that. I miss, so this is great. Not having this would have been a lot worse, but comes with its own sort of anxiety. So I logged on 3 minutes early for this meeting, because I don't know why. I'm always early because I don't want to be late. And you were actually 3 minutes late. I'm just saying, just throwing that out there.
That's true to type, then, isn't it?
So I had 6 minutes of anxiety about whether I'm on the right link, am I going to be late, am I in the wrong room? Doesn't matter, but it doesn't matter. But that's enough. And the other thing is, I didn't realise the extent to which I sit in meetings and rooms and with people and feel.
Yeah.
And I know I try and overcompensate for that online. And I just feel so blooming clunky.
Yeah.
I feel like I'm lobbing these things into the ether, and it's like, give me some feedback. Was that remotely funny? Was it interesting?
We're both readers of the room, and and so I've struggled to read the room. It's even more difficult when people don't have the camera on, and there will be all sorts of reasons why people won't have a camera on. They're not feeling great, or I don't know, but and I just think so. I'm just talking in this space, and I've got to fill the space, which is just silly. So it leads you to a whole way of behaving, I think, that is not not you.
Yeah, it will be interesting in a year's time to see what it all looks like, but it will be interesting to see what support and connection and whatever people need along the way, because I think there is going to be, you don't hold this anxiety for a year, do you? And some of the stresses that, some of the grief that people will be holding on to, people have, been through some really, really difficult times. And for some people, the fear of what's going to happen once evictions, particularly in the PRS, or, when that happens, if we lose the £20 uplift to universal credit, the people that we are working with and for, it's hard to be optimistic about the kind of world we live in at the moment.
I'm struggling with that. I mean, keeping the £20 uplift is vital, but for us, 1,000 more of our tenants are claiming universal credit, over 1,000 more on a 12 and a bit thousand stock. So we've got over 1,000 more households claiming universal credit. Now, part of that is due to furlough and already low wages dropping below, so universal credit's topping up. Some of that's due to job loss, but that's every one of those claims. There's a story behind it. There's some misery behind it. There's some difficulty behind it. I think that, and you're right. Actually, what we will be doing is at a point at which we have colleagues who are nervous and uncertain and not sure whether or not they want to venture out into the big wide world. We'll be, excuse me, we'll be working with tenants who have had that in spades. And so, one of the things around my presidency was understanding the impact of poor mental health on one another, on our customers' mental health, on us, on the way, if we lose compassion because we're mentally not well, the way that translates itself into the service that our customers get. There's there's going to be lots of stuff that will unravel over the coming year, and I think that will change the way, not only the way we provide service, but what services we provide.
And there are already, better than me, what the waiting times are for things like CAMS. The how much, I don't know, it's just that, the gaps, the services are not there. We don't do prevention anymore in the way that, we used to. And it doesn't look like that's going to change anytime soon.
No, well, we haven't got enough people trained to do it. Quite apart, even if there was a will to provide great community-based, accessible mental health services across the country, actually, there's a point at which you start from, and we needed to be starting from that years ago. We had a mental health crisis before the pandemic. Pandemic is just going to make it loads and loads worse. And so I think we just need to bear that in mind in our organisations. It's not, we are organisations that employ humans. We employ compassionate, kind people who are drawn to our wonderful profession because they are kind and compassionate people, and they, like everybody else, have been subjected to a pandemic that has destroyed confidence, destroyed people's well-being. They'll have had, you know, the point you were making around grief. You know, we've had we have not lost one of our colleagues, but our colleagues have lost parents and siblings as a result of this. They've lost tenants that they cared about. The impacts are devastating, and we need to, as organisations, think about how we can work with that in a kind and compassionate way that enables people then to begin to build confidence and flourish again. And it's going to be a really, really long job.
But to segue quite nicely then into the latest Wellbeing at Work report and what we can do to support each other, support people, you know, in our communities, how we work with the, you know, different organisations. What are your headlines? What would you say your top 3 things to say to people who might be listening?
So the things I was surprised about, I always knew there was stuff around young people and anxiety, and if our young people are far and away the most anxious in the workplace, study not just in housing workplaces, in every workplace, and you know, you think that's because priorities are different, or there's no sense of purpose in the work they do, and all of that sort of thing. And that well-being, the purpose for that well-being report was to find out how we could attract and retain young talent in what is quite an aging housing workforce. Being polite about it, but yeah, I can say that because I'm old. To see what we needed to do in order to create the mentally healthy organisations for them to want to come and work in. So I thought that would be about money. I thought it would be about lack of access to affordable housing, you know, the sheer pressure that young people feel under. So one of the big findings was about young people not having a clear career path, and therefore what that did was, if they can't see where they can go, they can't see where they can make a contribution, they can't see what their next step is, probably not likely to stick around. And if that's what's causing them anxiety, then as employers, I think that's not a hard thing for us to fix. And as the CIH, it's not a hard thing for us to fix either. And the professional standards, I think, have helped provide that professional framework. I think what employers need to do is to put alongside that the training and development and experience framework that enables people to get some real clarity. I had a clear career path. So yeah, so you asked for 3 things, but so that first thing is about employers. No, that's fine. That employers finding that clear career path, creating and working with the young people in their organisations to create that, to enable them to see where they're going. Because actually what we can offer as a profession is massive purpose. The purpose of working in housing has never been more necessary, has never been more keenly felt. And I think, you know, when we're working with young people who want to have purpose, actually we can really, really bring that. The other thing that I think that...
And we know that, I think we you know, just to butt in, I think we know, and one of the things we both really, really appreciated in our times as president of CIH was just getting to know that next generation, the generation after them. I mean, they're very kind to us. They let us join in with their, you know, when we like to think we're down with the kids, and they're actually 40 years younger than we are. That's slightly disconcerting. But we've met, you know, the the people involved in CIH Futures and, you know, across the 4 nations of the UK, just some stonkingly brilliant people, aren't they?
Yeah, so you look at people who are not just making a difference in their jobs, but making a difference in their communities. You know, it's all of the stuff that they bring with them. That it's just, I think we are very lucky, and we need to make more of it, because I don't think actually we understand as a profession just how lucky we are, and what amazing challenge they bring, what amazing, that sounds condescending and I don't mean it to, but it is about that, it is about that ability to think differently, that you and I, you know, we will see things from our perspective and our past, and we're a product of our past. Actually, they're a product of a different past, and we need to, we need more of that, and actually we need to encourage and support more of that. So there is, I think, something that we should be doing to value that and make it bigger, and we'll make it bigger by creating clarity, which gets rid of the anxiety for those young people, because they know what their purpose is and they know what they're working towards, and they're doing it in a great profession that can provide them with a rewarding, lifelong, absorbing career that's gainfully occupied me, but the thinking needs to continue to move on. So shall I talk about the second thing now? So shall I talk about number 2? So number 2 from that was that messages and good intentions of chief execs and senior leadership teams did not always reach the front line. So chief execs felt a keen sense of what the research found was that chief execs felt a keen sense of responsibility. So not only, you know, everybody was juggling how we provided services, what we did about repairs, what we did about what we did to support people who had got COVID, how we, you know, there was all the practical stuff then about how we managed. But then there was a load of stuff around well-being, I'll put it under that banner, where chief execs were doing stuff and were really appreciating what people on the front line were doing. And that was not felt in many circumstances by the people for whom it was intended. So we do need to think about asking the question, in what way can we do this better? In what way? Go on.
And I don't know, the world's changed, hasn't it? And I remember working for, you know, I first went to work for a local authority when I was 22, I think. I didn't know who the chief exec was. He was irrelevant. And, you know, the person who mattered was my boss and my boss's boss. And somehow, you know, there wasn't this sort of, almost in some organisations, you know, get the cult of the chief exec. Their opinion is the only opinion that matters in the whole organisation. And yet, I mean, I was thinking about that in terms of some of the discussions we've had in, you know, Black Lives Matter and around wider diversity issues. And somebody saying, well, all that matters is, you know, the chief exec's got to lead on that. And I just remember thinking, well, if you're a black plumber, you know, and your supervisor's racist, it doesn't matter a monkey's what the chief exec thinks. You are so far away from that. So how can we take those good intentions of leadership teams, but actually empower people, I hate that word, but to deliver that?
You empower people by giving people clarity, I think. You know, when people use the word empower, and the word empower doesn't mean everybody can do everything, because it is not true in this organisation that the person who sits on our front desk can make the same decisions as me. But actually, what I want is for the person who sits on our front desk is to use their judgment. And if their judgment tells them that they need to deal with this circumstance in a particular way, I want them to know that we will support them in that decision if that turns out not to have been the right thing. And we will challenge it, and we will put it right, and we'll do whatever we need to do. But for me, it is about that stuff around if you want to create a culture of trust, well, actually the first thing you do is you trust people. And when you think about you know the stuff around, I saw some stuff on LinkedIn where employers were installing software on machines so they could check how many keystrokes people did in a day, or what their online activity was, because they wanted to check they were working. Why would you employ people you did not trust? Why would you have a recruitment process that delivered people to you that you did not trust? So for me and at Grand Union, what we have worked really hard to do is to build a culture of trust. And that's about me sharing my vulnerabilities as much as it is about giving people the tools to get the job done, and say, off you go, do it in the best way that works for you.
Yeah.
And that's
what it's not about saying I trust you to make the identical decision that I would make if I was making that decision, which sometimes can help, and I think that's not helpful. So that's number 2. What's number 3?
So number 3 actually was, again, something that sort of came out in a very small way in the report, but I was at a seminar where Riverside had done a piece of research around the trauma in commissioning for homelessness services, because one of the things we looked at, so the trauma in the commissioning of, not commissioning services that dealt with trauma.
Yeah.
What we are dealing with are services that are in trauma because of the short-term uncertain nature of the funding. Actually, the impact that has on the services they provide, the individuals that they provide them for, and the people who are providing that service is massive in mental health terms. Nobody's got any certainty. And, you say nothing in life is certain, but actually what we have is initiative after initiative after initiative. One local authority dealing with something like 16 different initiative pots of money that have all got to be spent by next March. That's a ridiculous way to commission services that have such a fundamental impact on people's lives. And we are doing the people we are trying to serve a disservice, and we are doing the people who are doing the serving a disservice. So actually that third big finding for me, which is what Riverside have taken in and done this report around, is to find a proper sustainable footing for funding services that are not popular or sexy, but like drug and alcohol services, all those things that people would rather not think about. But absolutely, if we want people to fulfill their full potential, they're absolutely essential. They need to be put on a proper certain footing, because we are not just damaging the life chances of the individuals we're helping, we're damaging the people who are trying to do it. And that's not sustainable and not desirable, and actually is probably wasting more money than it serves. And there is something, I think, allied to that it wasn't picked up in our research, but there is something to that around the crippling effects of poverty, because actually what we and that didn't come out of the wellbeing report, but what we are seeing is the beginnings of the crippling effects of poverty that I can remember from the late 70s and early 80s. And I think we're still dealing with the consequences of that late 70s and early 80s. And do you know what? We're creating more consequences for 20 and 30 years' time, because we've missed loads of opportunities around creating good healthcare, good education, good homes for people to live good lives in. and that costs our services money, but actually it wastes human potential. And I think we should be tolerating a society which allows that to happen. Big words, aren't they?
So one of the good things, yeah, but no, made me think about another positive from lockdown. So I'm trying to be positive. Is the number of webinars and events and things that have gone online, and I think which is massively democratizing in a lot of ways. And at this point, I think we should do a plug for CIH membership and free events for anyone who joins CIH, which is absolute game changing. So if you're not a member, go online, have a look. And we'll look forward to welcoming you. But I've been to some amazing webinars, and we even pretend we're going to them. So we'll sometimes say, "Oh, we're going to London tonight to learn about, blah blah blah." Two that spring to mind. One was an interview with two of the women who'd worked at Bletchley, both of whom are 97 years old, and goodness me, what incredible lives and of these two women. What resilience. But one of the other ones was I chaired something for CIH, I think with the Southeastern Conference, but it was someone from the Mayday Trust, which is an organisation I didn't know very much about. Somebody called Robert White, who loved, he'd been a commissioner and was now working for the Mayday Trust. And again, if you don't know them, just have a look. The entire, it just turns the way you think about services on its head. And I think they are so the right time, but ahead of their time. So that's been great to be able to interact with subjects and things that you weren't able to do before. But I am really looking forward to being able to meet people in person. I've kept you for ages. We've been chatting away. This has been an absolute joy, and I think Nigel and I were saying earlier at the beginning of lockdown, we did lots of online drinks, online quizzes, online this, that, and the others. And that carried on through the whole of the first lockdown. And then I don't know if this is lockdown 2 or lockdown 3, but since Christmas, it's just been head down. And maybe because it's, because of the weather and because of the dark evenings and, all that sort of thing. But it's just been getting through it, hasn't it? And then maybe now we can have a bit of a hope that we're going to have a bit of summer, and a bit of normal, and some hugs,
I think we've got a date for hugs, haven't we?
That's going to be nice.
When
I've been really depressed and finding it really struggling and talking to Dan about it, I remember once he said, "Well, you just need to go and see Aileen." And when your kids realise what it is that's good for your mental health, I think that's a sign of something nice.
We haven't actually. I feel like I've known you forever, but we haven't actually known that one another. Is it 8 years, 7 years, somewhere around there?
Twitter friendship. Whenever anyone says Twitter's ruined the world, I say, but.
Yeah, no, absolutely. No, I think used well, it is brilliant. But I think you are right. Next time you come to ours, we can go to Bletchley if it's open, because it's only a few miles from us, and we can go.
Is it really? That would be wonderful.
Taking my mum and dad.
Treat.
It is wonderful. We can take a picnic and stuff like that. But I've given my girls hugs on their fingers, so if they need a hug, they can put their fingers together and they can feel a hug. Both my girls are very feeling children, but but it's not the same as a proper bear hug from people that you love and care about. And actually, can't wait. I can't wait. It's been an absolute pleasure today. Sorry about the ringing phone.
Thank you so much. And
thank you.
That's right. Thank you for having me, and see you very soon.